Ladies and gentlemen, please welcome Dr. Bruno Leroy, Vice President, Global Access Strategies and Integrated Patient-Centered Solutions, Sanofi.
Hello, everyone. So I'm Bruno Leroy. I'm VP for Customer Value and Access Strategies at Sanofi in one of its business entities, Patient-Centered Solutions. And I'm here today to provide you with concrete experience that we've faced in the development of wireless solutions at Sanofi. Sanofi is a large, diversified healthcare company. It has several entities, including ours, diabetes, oncology. And all of them now have the mandate to develop integrated solutions. And we started over a little 2 years ago. And we used the input of a board of experts coming from outside pharma, a board of innovators. And this board of experts emphasized immediately, they gave us two advice. First, go deep in customer insight. And second, prototype rapidly. And this is what we've done, and this is what I will focus the talk on today. We face some challenges, but we have very interesting lessons learned from this rapid prototyping. So first, I'd like to show you how we define integrated solutions. We are not providing a full integrated solution. That's the mandate of healthcare providers. But what we think we can help with is around patient symptoms, associated symptoms, comorbidities, social impact, or along the continuum of care, addressing gaps in care. And this by either improving patient outcome or patient experience or metrics of disease management or metrics of patient behavior. And by various offers, drug, diagnostic, delivery device, and services. So when we speak about integrated solutions, is when we have either 2 or 3 of the patient needs addressed, or 2 or 3 of the offer provided. In order to ensure sustainability of our business models, we've landscaped services worldwide in a large study. And you can see here it provides a framework of the profitability and the customer engagement of the health services. We're not looking necessarily at the sweet spot here that is circled, but it sort of guides us into the way we frame our business models. This is a typical innovation process that we follow. And so we start, obviously, with an innovation question. And this is, for example, for a renal compound. How can we change the belief about calcium and phosphorus? How can we increase adherence? So we have creativity sessions, 200 ideas, so divergence, convergence in concept, and selection of 3 concepts that were further prototypes. So 2 gaming solutions that we have prototypes. The point here is that we've selected casual games so that it can bring fun to patients and providers, caregivers. And we inserted also educational quiz in those gaming solutions. We've chosen based on the feedback of patients. We've chosen one of those games, and it has been launched in prototype and launched in Asia. And it's already requested by several countries worldwide. So what we can see here is that these type of solutions are really easy for people to grasp. The uptake was really extremely quick worldwide. We can see also that we have a really large reach with these solutions. Another one was using what is already existing in the company through our diabetes divisions with a very successful app, which is called Go Meal. And we've expanded that to phosphorus diet to help renal patients. But what is interesting here is that in this prototype, we've also included automated reminders and achievement goals that were coming from other prototypes. So something easy, again, from prototype to prototype, we've built something that we have now that we are now testing. In osteoarthritis, we've built a little bit based on the landscaping. We've used the automated reminder concepts and the coaching concept, and also the assessment of pain to increase the dialogue between patients and their physicians. The coaching part was in fact added once we had this prototype tested with patients. The feedback of patients and providers on automated reminders and pain assessment was really excellent. So this is now in the second phase and is planned to be launched at the end of the year. Another one was the testing of a tablet for adherence solutions, where we had alert system, automated reminder, access to a pill book, and SMS feedback loop to caregivers. And we've tested that with pharmacists and patients. Again, well accepted. We've been able to change this solution to something now prototype with more portable, more flexible, and we've also derived a new program based on SMS. I can tell you that I have tested also this solution with someone close to my heart who has Parkinson's disease, and I can really testify. Obviously, having a lot of treatment is very interesting for patients, but the situation becomes really unbearable at a certain point for the patient and the caregivers, and often going south when there is no adherence. And implementing a surveillance of this and a help to the caregiver by this tablet enabled to completely reverse a situation that was completely degrading, to put back the healthcare provider back on track in the care of the patients, and to decrease the emotion in the treatment of this patient. So I really think that I have a living proof of something that was really effective on a daily basis. Something a little bit more complicated, and that tells you the graduation of the complexity of the prototypes, is when we want to tackle telemonitoring solutions for cardiac insufficiency. Here, the rationale is a real medico-economic rationale. You want to decrease hospitalization, so we've built the solutions with an acute and a chronic phase, and we've already piloted it in France, in fact, to see if it was consistent with the healthcare system in France. Here, the feedback is the difficulty for us as a pharma company to move quickly in this setting. We tend to we are slower probably than others because we have processes, heavy processes. But clearly, when we add all the solutions that we've built before, plus this one, we have now built in a small unit something that enables us to move faster and faster. So in summary, a pharma company, and specifically Sanofi here, we know we have assets in customer insight, in outcome research, particularly in a regulated environment, and very large market reach. So for example, for the game, quickly we have 12 countries plus asking for the game in 2 months. We have now a clear view of how to develop integrated solutions, and clearly rapid prototyping, partnerships is really where we need to be helped with. And this is also one of the rationale for me to present that to you today. This is where we've made the most progress. An advice to people in other pharma companies who would like to build something: do it rapid prototyping, do it rapidly, and then it will also help you to grow and demonstrate within the company and get confidence that we can develop integrated solutions. So that's it for today. Thank you.